My name is James Wall, and I understand this video will be used by the Chamberlain College of Nursing, and it has my approval. Come in.
Hi, Mr. Wall. My name is Hannah. I'm your nurse today. So today we're going to be doing a NG insertion and removal. So first, I'm going to wash my hands, perform some hand hygiene, provide for privacy, and then I'm going to go ahead and identify you.
James Wall, 82494.
Do you have any allergies?
No.
Okay. And then have you ever had any nosebleeds?
No.
Okay. Do you have any history of aspiration,
No.
nasal polyps,
No.
anticoagulant therapy?
No.
Have you had chronic sinus infections?
No.
And have you had any oral, facial, or sinus surgery?
No.
Okay. So like I said, my name is Hannah and I'll be your nurse today. Your doctor did order an NG tube insertion and removal. So first I'm going to go ahead and place my supplies on a clean surface. So the reason for doing this is to assist with feeding. And then we'll be removing it just to provide a new one at a later date. Do you have any questions?
No.
Okay. Do I have your consent?
Yes.
And you may experience some discomfort while doing this.
Okay.
Do you have any pain right now?
No.
Are you nauseous?
No.
And have you vomited recently?
No.
Okay. First, I'm going to place him in a high Fowler's position, the bed to the level of my hips, and then I'll prepare the tape and place it on the side of the bed table. So I've used 2 strips total, and then 1 strip cut in half at the midway point. My kit actually did not come with an NG tube insertion and removal, so for the purpose of this video, I'll be using a straw and a water bottle, and I'll be verbalizing everything else. Okay. Alright. Now I would open the package of the NG kit, put on some gloves, and I'm going to look into the nose. If you'll lean your head back. I don't see any obstructions, nasal polyps, irritation, or a septal defect. Okay. So you haven't had any recent nosebleeds, trauma, or irritation, right?
No.
Okay. I'm going to go ahead and massage your patency, so breathe in. Bilateral patency is noted. If you'll go ahead and open your mouth for me. Patient does have a gag reflex. Okay. Alright, so we're about to begin. Now, I'm going to go ahead and auscultate the lung sounds though. Start on the side to side. Just breathe normally. Now we'll listen to his vowel sounds. Normal vesicular lung sounds heard throughout, and vowel sounds were hypoactive. Okay, so if you feel any pain or if you want me to stop at any time, just raise your finger or your hand for me, okay?
Okay.
And then I'm going to go ahead and measure for the tube for the length of insertion and mark where it will end. So I'd measure from the tip of the tube, from the nose to the tip of the earlobe, and then from the nose to the tip of the xiphoid process. I would lubricate the first few inches of the tube. I would place a towel across his chest and an emesis basin within reach with tissues. And then it will be about to begin. So I would insert the tube slowly with 60 milliliters attached, back and down towards his ear. If you'll go ahead and touch your chin to your chest, I would keep advancing it each time he swallows. until the mark spot is reached. Okay. And then I would remain holding the tube at all times. I'd go ahead and check the back of the throat. Okay. And I would anchor the tube to the nose here and then also to his gown. How are you doing?
Okay.
Okay. I'll go ahead and listen to the long sounds again. Okay. Now we're going to be removing it. Actually, no, I would remove the gastric contents, test it with pH paper, and then I would send it to the x-ray to get an x-ray for feeding. And then I would reinsert the contents unless told otherwise. Okay. And like I said, I would clamp it at the end, keep the head 30 degrees elevated. And now we'll be removing the tube. So first I'd remove the tape from the nose, detach it from the gown, hold your breath for me, withdraw it, controlling the tip gently, and then I would inspect the tube for it to be intact. I would discard it and discard all waste, discard my gloves. How are you feeling?
Okay.
I put the side rails up, perform some hand hygiene. The bed is in the lowest and locked position. Call light is within reach. Hand hygiene again. And then we are to